So much. Good morning, good afternoon, and good evening, colleagues. My name is Brian Morales, and this is the Global Coalition to Address Synthetic Drug Threats, Sub-Working Group 3.1. I am going to share my screen, and we will get started. Okay, I want to start off by saying that this is a special session. We have civil society participation throughout today's session. And I want to start off by thanking the Vienna NGO Committee for past work in hosting meetings of the coalition and for compiling feedback, input, experiences of civil society organizations around the world. Now, this session will only include presenters from civil society organizations, but importantly, not participants. We didn't open up the participation list to all civil society participants. The representatives of this meeting are still the government representatives. And per our usual practice, we will record the presentations, but we will stop recording when we arrive at the discussion question and answer phase. Now, something very important also for our colleagues, this is an important time, an important phase of the coalition, the implementation phase. And we are today requesting kindly that participants report on actions that they have taken to address synthetic drug threats. It's important that we start compiling all of this outreach at this stage of the coalition as we work toward a year one report that we are looking to publish in September and release at the UN General Assembly. So we have conducted some outreach. Our US embassies in your countries are reaching out to your foreign ministries to request actions. We are also sharing the reporting process with you today in the next few slides. And we will also send you an official letter requesting a report of your actions. These actions, your submission will be reported or shared on our website, and some content may also be shared in that year one report that I mentioned. So what actions can you report? And I want to be clear that this is from the period of July 7th of last year, when the ministerial meeting launched our global coalition, through September of this coming year. So some of the information could be looking toward the past. The other could be looking toward activities that you intend to do over the next few months. So first, the adoption of a new practice, a policy, a strategy, a regulation, or law at your national level. Second, you can report if you've launched any new engagements or collaboration with the private sector. Third, you can report any financial support that you've provided bilaterally, including through international organization partners, or any in-kind assistance to build your country's capacity or to advance an initiative that addresses a synthetic drug threat. Next, if you've hosted or plan to host a regional or global meeting on a thematic area of interest for the coalition. Fifth, if you have expressed interest or are going to in a specific initiative of the coalition. These are the international organization initiatives that are on our website, over 120 of them. And if you've expressed interest to participate in any of them, even if you haven't sort of begun that collaboration, that would be another opportunity. And finally, any other act to strengthen your country's response to synthetic drugs consistent with the recommendations also should be reported. We are asking that you submit a report no longer or no greater than 2 pages total. And we are asking that this be sent to us in Microsoft Word format or just in email text so that we can easily copy and paste that into the different formats. The deadline that we have requested is the 3rd of June, and you can send these. We would prefer for them to be in English, but you can send them in your national languages as well. We're asking that you submit them to the email address syntheticscoalition@state.gov. And where are the recommendations, you might ask? We have now posted them on our website under the timeline tab. You will find an orange bar that says final key recommendations, and you can click on that and see the 68 recommendations that have been posted. And finally, I will end in saying that this is the last, we're coming toward the end of the opportunities to present in the coalition meetings. In September, we will have our final working group meeting for the coalition year one, and we will have the sub-working group meetings throughout the next several months. So if you are interested, please email us and let us know that you are interested in presenting in a future session. So with that, I will say if you have any questions about the report, you can always email them to us or you can submit them in the chat. I'm going to stop sharing my screen, and I'm now going to turn it over to our co-chairs for Subworking Group 3.1. Our co-chairs are Inga Dora Sigfusdottir and Carolina Bruse, and I see Inga Dora and Carolina on the line. So Inga Dora, over to you. Thank you so much.
Thank you so much, Brian. We are going to start with a presentation from Kane Meyers, who is the Chief Scientific Officer for the Icelandic Center for Social Research and Analysis. He's going to tell us some more about community-based prevention. His speech has already been recorded, and so I rely on our technical team to just start when you're ready.
Good morning, good afternoon, good evening, depending where you are in the world today. My name is Kane Myers, Chief Scientific Officer of the Icelandic Center for Social Research and Analysis. It's a pleasure to be here with you today. I'll be talking about upstream prevention of adolescent substance use, insights from the Icelandic prevention model or the Icelandic approach. And I will also go over some of the latest research looking at how the model has been adopted in contexts outside of Iceland in recent years. Before we jump into it, a brief overview of the topics we'll cover today. First, I'll give a bit of background on teenage substance use in Iceland over the past 2 decades. Then we'll talk about implementing the model itself. First, we'll talk about the guiding principles, so the core philosophy that underlines all of the prevention work as part of the Icelandic model. And then we'll talk about the practical steps of implementing the model. And like I mentioned, then we'll have a brief overview of some recent research from within this field. So in the late 90s, the SPAD survey situated Icelandic youth among the highest substance use users in Europe. And this coincided with what was already known in Iceland among both practitioners, researchers, but also community members. The experience is often described as the streets of Reykjavik, the capital of Iceland, as being filled with teens as young as 15, 16, intoxicated. There are also reports of theft, vandalism, and forms of violence going on at the same time. So this awareness, coupled with the reality from the European survey, mobilized a group of researchers, policymakers, and community members to do something about the problem. And we'll talk about that today in the guiding principles in the Icelandic prevention model. These are based off the last 20 years of their work, but it should be noted that they did not necessarily know at the time that they were doing anything systematic. So it's quite interesting in that way. So we'll first talk about the underlying principles or the underlying philosophy of the Icelandic prevention model. This is based on a publication by Christensen and colleagues in Health Promotion Practice. Again, this is sort of a retroactive look at what was going on over the past 20 years. So these are the types of beliefs that the community members, practitioners, and researchers were holding at the time when implementing interventions. So the first is apply a primary prevention approach that is designed to enhance the social environment. Early research in Iceland, even before the survey was released, identified 4 key domains within the environment of Icelandic adolescents that influence their health and behavior. In these 4 domains, as you can see here, are family, peer group, school, and leisure time. So embedded within these domains are risk and protective factors that influence or discourage against substance use. So principle number one is saying that your prevention approach should mitigate the risk factors and encourage or promote the protective factors that are embedded within these domains. Guiding principle number two, enhance community action and embrace public schools as natural hub of neighborhood area efforts to support child and adolescent health, learning, and life success. Essentially, this is to say that intervention efforts should be conducted where children spend most of their time. And in the case of in Iceland, and certainly in other places around the world, this tends to be the school. So embracing the school as the natural hub for these efforts is what makes the most sense, or made the most sense. Guiding principle number three, engage and empower community members to make practical decisions using local, high quality, accessible data and diagnostics. So collecting data on the social environment, so a survey that includes the risk and protective factors that are embedded within the four domains that I discussed earlier. Each community collects data on these factors, and then they should also receive an individualized report on these factors, because what could be driving substance use in one community may not necessarily be the same in another. And there are all sorts of reasons for why that might be the case. Guiding principle number four, integrate researchers, policymakers, practitioners, and community members into a unified team dedicated to solving complex real-world problems. So in our case, or in this case, of course, it would be substance use. In order to carry out the intervention efforts, you need a team, an interdisciplinary team. In theory, this often sounds nice, but as we know in practice, it tends to be harder. And usually these individuals continue to function on their own, and they're at varying distances from the problem itself. So a core component, or as we'll see in the steps, is building a coalition that integrates all of these members together, and they're in constant dialogue and working together throughout the entire process of intervention efforts. Guiding principle number five, match the scope of the solution to the scope of the problem, including emphasizing long-term intervention and efforts to marshal adequate community resources. So social problems that take decades to create are seldom solved overnight. Solutions to these problems should bear in mind that it can take years, maybe even decades, to fix the problems that exist within society. It also is overcoming some of the issues of short-term political will and short-term political tenure, for example. In many places of the world, political tenure is designed to last anywhere between 4 and 8 years. And then we typically see a party shift, which can be a shift in agenda. So in the early planning of interventions, it's important to have all parties, regardless of affiliation, at the table to agree that this is a long-term endeavor and requires long-term commitment of both resources and funding, to ensure that when one member exits, the work gets carried on. And the same can be said for key positions that are involved at the various levels of intervention, such as the community level. We know that often when key people or key players leave, usually the project goes with them or doesn't get carried on. So it's ensuring that when they leave, somebody else is able to step in and ensure that the work gets carried out. So those were the 5 guiding principles of the Icelandic prevention model, and now we'll talk about the practical steps to implementation. You'll recall throughout the discussion of the principles, there was an image of a compass. That's to signify that you keep the principles in mind to guide your intervention efforts when you're actually taking the practical steps. So the first 3 steps involve community capacity building. Step number 1 is identifying a local coalition, developing this coalition, and expanding and building their capacity. So this coalition, again, is the researchers, practitioners, and policymakers, key community members, sometimes known as community champions. All of these people working together on the same page with equal levels of commitment and ownership over the project, and in constant dialogue. So step number 1 is expanding that capacity and building it. Step number 2 is identifying local funding and expanding the capacity or building the capacity of funding. Note how that comes after building the coalition. So the coalition really is a fundamental part of a fundamental component of implementing the Icelandic prevention model. That was key to the success in Iceland. Step number 3, pre-data collection planning and community engagement. So after you've identified your coalition and after you've identified your funding and secured it, then you can start planning data collection and getting the interest of the community on board. Next are implementation of core processes, steps 4 to 9. So step 4 is the actual data collection. So this involves using surveys that measure the risk and protective factors that are embedded within the domains that I discussed earlier, the processing of the data, including data-driven diagnostics. So like I mentioned, each community will have issues that are unique to their specific community. So it's important that they receive a tailored report based on the risk and protective factors that were measured. Step number 5, before step number 5, step number 4 again also includes regional level reports. So this is for policymakers or people who are involved in higher level decision making. Step number 5, enhancing community participation and engagement. So this is before you actually share the findings with the community. You're rallying the community, you're ramping up interests, you're getting them interested in the issue. And then step number 6, you actually present the findings to the community. And again, the findings will be tailored to that specific community. It'll be delivered in a way that is accessible for the community to understand, often using cross-tabulations, for example, or simplified language. Then that takes us to step number 7. After the results have been delivered, the coalition with the community sets goals and organizes responses around these findings. So this is why the coalition is so important, because it involves all key players at all levels. And it's important that higher level decision makers listen to practitioners and community members because they're aware of what's actually happening on the ground. But also the opposite is true, that there's trust in the higher level decision makers about boots on the ground work that can be carried out and so on and so forth. So the coalition also, because it has the component of transparency, it's also meant to build trust and, again, a constant dialogue between these members. Step number 8 is actually aligning the policy, so the higher level policy and practice within the community. And then step number 9 is the actual immersion of children and adolescents in the primary prevention environments, activities, and messages. Finally, we have step number 10, which is repeat all of steps 1 to 9, usually annually. And you may have noted that I included an image of a spiral staircase earlier on. instead of linear stairs, if I can say it that way. And that's to signify that really the Icelandic prevention model is circular. You're often going back to where you started multiple times and going through each process again. But like a spiral staircase, you're always getting closer to your desired goal or outcome. And moving beyond Iceland, we'll have a brief overview of a few studies here. There's certainly more out there, and I encourage you to look for yourself if you're interested in the model. I will go through the ones I am most familiar with that have been done by my colleagues. So the first one here, between 2006 and 2019, under what was known as Youth in Europe, Lithuania implemented the Icelandic prevention model. This could probably be best described as an outcome evaluation. And what they found was that following the implementation of the Icelandic model, not only did they see a decrease in some of the key substance use metrics, they also saw increases and decreases in risk and protective factors, again embedded within those 4 domains in their assumed direction. So that is to say that what was relevant in Iceland it may also be relevant elsewhere, at least in the Lithuanian context. Similar story when looking at Tarragona between 2015 and 2019. So this is located in Catalonia, which is in southern Spain, and they found between this time period that the risk and protective factors embedded within the Icelandic prevention model, for the most part, were applicable to the Catalonian context. In Franklin County, Kentucky, policymakers, community members, and so forth there attempted to replicate the Reykjavik City Leisure Card. This is essentially a voucher that pays for organized out-of-school activities for students, so eliminating the financial barrier. And at the same time, they worked to increase the number of activities available to the students in the area. And within a 1-year time period, they saw that there was a substantial increase in the number of students participating in organized leisure activities outside of school, and also that certain demographics might have benefited more than others. And it seemed to have a positive benefit, mostly for those, of course, who came from lower financial backgrounds. And then finally here we have a process evaluation of the Planet Youth project in Ireland. So they are implementing the Icelandic prevention model under Planet Youth, a research consultancy here in Iceland. And some of the main findings of the process evaluation look promising. So I encourage you to look that up for yourself. So I've listed it here for some extracurricular reading. Okay, that's it for me. I would like to thank you all for today. That was a very quick overview of the Icelandic approach. But if you're interested in chatting more or learning more, I encourage you to reach out to myself. My email is provided below, or my colleague, Dr. Ingadora Sigfúsdóttir. I've also included her email here as well. And if you ever find yourself in Iceland, of course, please do give us a visit. Our address is listed below as well. We'd love to see you. Okay, thank you so much for your time today, and best wishes to all.
Thank you so much, Kane, for your excellent and clear presentation. Now I think we can all go out and do just exactly, if we follow your recipe, it should work. So, but I'm gonna hand over to my co-chair colleague, Carolina, who is going to introduce the next two speakers. Over to you, Caro.
Gracias, Inga. Buen día a todas, a todos. Vamos a seguir trabajando y conversando, esperemos, sobre la prevención comunitaria y para eso nos acompaña, vamos a hablar sobre el modelo de cambio comunitario de CADCA, que nos va a contar sobre la ampliación, cómo vamos aprovechando las estructuras y los sistemas y los recursos de la comunidad a través de este modelo de cambio, ¿no? Para eso nos acompaña Eric Siervo. Eric, no sé si está Elaine, perdón, no la pude ver en todas las pantallas, pero si está contigo, bienvenida también a ambos para que podamos conversar sobre esto.
Sí, muchas gracias, Carolina. Los dos estamos aquí. Y les comento, porque Eliani habla portugués y yo hablo español, vamos a presentar hoy día en inglés para tener una presentación uniforme. So it is a pleasure to be here with all of you today. And so good morning, good afternoon, good evening, wherever you are in the world. First and foremost, I'd like to thank our friends and colleagues at INL for the opportunity to present on the work that we're doing around the world to scale up community-based prevention.
And Eric, my apologies. I'm sorry for interrupting. You need to be in the English channel if you speak English. Can you please switch to the English channel and continue? Thank you.
Oh, certainly. Is that better? Are you able to hear me now?
Yes, please go ahead.
Okay, thank you. Just wanted to make sure. So thank you. As I was mentioning, it's a real pleasure to be here today to talk to all of you about scaling up community-based prevention and what that looks like. You know, you know what? I don't believe the screen is sharing. Are you able to see the screen?
We are able to see the screen, but you may want to
Sí,
move your
sí,
presentation into
estamos
the
viendo.
presentation mode, please. And in order to do that, click the slideshow and then from beginning. Otherwise, yes, we can see your screen.
Okay. And it looks like I do have it on presentation mode. It looks like it's sharing the wrong screen for some reason. Let me try that again. How about now? Are you able to see?
Now we can see your slide in the presentation mode. Please go ahead.
Thank you so much. So as I was mentioning, we're going to talk today about scaling up community-based prevention. And for that, I'm going to speak a little bit about CADCA and what we do to equip communities with what they need to know and what they need to do to be effective change agents. And with me is Eliani Prado Marcondes, the president of the Association Pro Coalitions of Brazil, to talk about how this is being implemented throughout the country of Brazil. So first and foremost, to give a little bit of a backstory on who we are and what we do. CADCA is an organization that exists solely for one purpose, and that is to build capacity of communities, develop community coalitions, and equip them with the knowledge, skills, and abilities that they need to create and maintain safe, healthy, and secure communities. We've been doing this now since 1992. We were born out of a presidential drug advisory council that in those days brought together over 400 community coalitions from across the country. And one of the outcomes was the need for an umbrella association and national representation of this grassroots movement. And that's exactly what CADCA to this day represents. And in order to equip communities to be successful in developing coalitions and achieving outcomes, we have a model for community change, which is predicated on two parallel goals. First, the need to increase collaboration among groups and sectors of a community so that they're able to develop the necessary social capital to address local problems through community mobilization and civic engagement. However, it's not enough just to bring people together. We need to give them direction and guidance towards, in this case, the other goal, which is to reduce substance use rates among youth and over time adults by addressing the root causes and risk factors that increase substance use at the local level. So to achieve these two overarching goals, community coalitions are a perfect vehicle where they are a formal collaboration of groups and sectors, representatives of institutions and organizations working hand in hand with neighbors and residents to address the local problems in their community context by sharing knowledge, skills, resources, and rewards towards having a safer, healthier community for all. So in order to equip coalitions with what they need to know and what they need to do to be effective change agents, we have our 3 pillars to our model for community change. First, it takes a village. And in that village, you need a winning team. So we talk about forming a winning team by bringing together a minimum of 12 community sectors, where we want to see all these sectors come together to establish a coalition focused on addressing, bringing about, I should say, local solutions to local problems. I won't go into this extensive list because I'm sure we'll have an opportunity to share it, and Ileana will talk about this further. But I do want to say that you'll see here youth as one of the sectors. I just want to reiterate here and really home in on the fact that youth in this work are partners at the table. It's not just about lecturing youth or focusing all programs and services directed at them, but really giving them an opportunity to voice what the risks look like in their community. If we want to protect them, then we need to know what they know, and they need to have a voice in bringing about solutions. I'd also say that the second pillar of this problem, that first pillar really gets at the first goal, increasing collaboration among groups and sectors of the community. For the second goal, we equip communities with prevention science. And for that, it's not about jumping in interventions, but really having a clear community assessment based on epidemiological data, understanding what substances have the greatest impact, what populations are most vulnerable, where do these problems manifest themselves within the community context, and then based on that, looking at the local capacity, the prevention infrastructures and resources. Where are we? What do we need to address the issues that communities face locally, and who else needs to be involved at the table? Through that, take communities through a strategic planning process where they develop long-term strategic plans and annual action plans, so that they have a clear idea of the interventions that they need to put forth in their community to bring about change. We also want them to evaluate their interventions for outcomes. And at the core of this strategic planning process, the strategic prevention framework, you'll find sustainability and cultural competency, because all the resources are driven locally by all of the sector representatives. And we have a credible process for them to follow to achieve outcomes. The third pillar of this too, though, is to ensure that when we have a broad-based coalition, we're not just focusing on services and programs. While services and programs are important, they're not going to achieve an ecological outcome. So we also want coalitions, while they're doing their individual strategies, and in the case of community coalitions, really should be focusing on the resources that are there and the gaps that are there, to make sure we have a whole of community approach to get resources to their intended needs. But we also want them to focus on those environmental strategies that really get to changing policies, practices, and systems, yielding changes in access and availability, community norms, attitudes, and behaviors. So one last piece that I'll mention about this model, with communities, ground zero for the work is the community that we want to impact. Bringing together all of those different sectors to the table, not only one gives us the key ingredients that we need to start a coalition, but it really allows us to map prevention resources and infrastructure within the community context. The strategic prevention framework takes us to surface those conditions on the ground in the communities, those problem environments, or those areas in the community that manifest themselves in a way that is very specific, identifiable, and actionable, so that way the communities can get to promoting comprehensive strategies to address the risk factor, the root cause of those problems in the community context, allowing communities to achieve population level outcomes impacting the entire community. I will just say, though, about scaling up, it's not enough just to have a community coalition, but it's important to leverage the systems and structures not only locally to sustain those coalitions. They should become part of the local system to be around for the long haul. It's not enough for coalitions to be multi-sectoral, but they should be multi-generational, multiracial, multi-ethnic, and to be around for the long haul. And I will say that in the United States, we've managed to scale this up to, we're an association of over 5,000 community coalitions, all 50 states, U.S. territories, and we're also working around the world. But in the United States, the Drug-Free Community Support Program is one way we've made it possible for this approach to reach the entire United States. It's not something we certainly do alone. This program is authorized by Congress, and it's housed at the White House Office on National Drug Control Policy, where it is part of the United States drug prevention strategy, I should say National Drug Control Strategy. This is also administered through the Center for Disease Control. CADCA does all the training and technical assistance and ongoing support to communities building coalitions through this program. And there is a national evaluation under ICF. And as you see to the right, there's an image there on the outcomes of the DFC program. I won't go into details there, but on the chart, you'll see 4 core measures that not only have they tracked in this last cohort, but going back over 20 years. And you can find more on the Drug-Free Community Support Program in the outcome data at whitehouse.gov. As I mentioned too, we've been doing this work now with INL going back to 2005. And when we first started working with INL, today we're in 29 countries, but all of this work started with us in INL in the metropolitan area of Lima, Peru. And the initial pilot of community coalition development was done between 2006 and 2011. An evaluation done by the University of Kansas, the University of Michigan, and Cayetano Heredia, surfaced the community changes that were happening at the district level where these coalitions were formed. And through this period, they saw reductions not only in gang-related problems, overall crime in the neighborhood went down, buying and selling of drugs was also reduced, as well as drug use in the neighborhoods. And of particular interest was the reductions in alcohol and marijuana use among youth and young adults. I'll also mention too that, this work, the success in Peru expanded this to other parts of Latin America. There was another major initiative in Mexico where we had researchers from the University of Texas at El Paso that conducted student surveys and household surveys. In a 1.5 year period, they did a pre and post in 18 cities in Mexico where coalitions were located. And these were some of their findings in terms of reported past 30-day use among a whole host of substances. I'll also just mention that there's 2 other published studies by Dr. Brown, the University of El Paso, Texas, one in 2016, where they look at the conditions with coalitions in Mexico versus those in the United States and how effective they were in bringing about community change, as well as a study done in 2022, looking at where these coalitions are today and coalition functioning over time. I'll also mention too briefly, as I showed the map earlier, of how we've developed over 400 coalitions in 29 countries around the world with INL. Specifically as it relates to South America, we have 69 community coalitions in countries like Argentina, Colombia, Brazil, Ecuador, along with Paraguay, Uruguay, and Peru that we're actively supporting in their development. And 4 countries between Central America and the Caribbean, where we've developed 35 coalitions. And we're in Costa Rica, Dominican Republic, Guatemala, and Honduras, where we're actively working. Again, much like we saw in the United States, getting to something like national drug control policy and being a part of that, like we have in the United States, we're working on this with INL and all the countries around the world where we work. It's not just enough to build a coalition locally and get them as part of their local agenda, getting on the local agenda, being part of that prevention infrastructure. But we need to replicate and expand. Once we do an initial pilot, it goes from theoretical really to peer-to-peer, practitioner-based lesson learns from the context of each of the countries and communities where we work. But once this grows to a certain point, It's important to consolidate these into networks so that we can start to thread the needle and weave what's happening locally bottom up to what's happening nationally top down through policies, practices, and systems so that we can achieve national adoption. We have several examples of where this has happened, and having national associations are a key to that success because it builds systems and structures, much like CADCA is an association that represents that movement nationally. We've replicated that in countries around the world. And today, specifically, I'm going to hand it over to Eliane, who's going to talk about how this has come to fruition in Brazil.
Good morning, good afternoon. Can you hear me?
Yes,
Yes.
we can.
Eleni, you need to
Thank
be in
you.
the English channel, please. If you speak English, you need to be in the English channel, please. Can you select the English channel and continue? Thank you.
How to do that? Show captions.
You need to click the icon of the globe on your screen and then select the English channel. So there should be an
Okay.
icon of the globe and select
All
English.
right.
Thank you.
Yes, there I go.
Thank you. Go ahead, please.
Is it okay? Is it okay now?
Yes, go ahead, please.
Thank you. So again, good morning, good afternoon. And I really want to say thank you for this great opportunity for being here together with CADCA's Vice President for International Program, sharing the experience of the Association of Brazilian Coalitions and how the scale up happened in the country along these 16 last years. So we had a strategy, as you all know. Brazil is the largest country in South America, and the population is of 203 million inhabitants for the whole country. So there was a strategy for this scale up. The strategy was to start in the most populous state, that is São Paulo state. As you see in the map of the country, the largest number of coalitions and the pilot coalition started in the state of São Paulo, where we now have almost 14 coalitions in this state. So I'll tell you the story. I would like to have Eric helping me changing the slides, please. Okay, so this development was possible through training sessions with CADCA, and everything started in 2008 in a pilot city of the state of São Paulo, and the strategic position and geographic position of this community, it's because it's between the capital city of the state of São Paulo and the neighboring state of Rio de Janeiro. So Pindamonhangaba is exactly in the middle, geographically meaning. And the implementation of this coalition could inspire and bring the expansion of other coalitions nearby and neighboring cities around in the region. So with the technical support of CADCA and the financial support of volunteers, partners, faith communities, and local governments, we could develop in the region. So Pindamonhangaba Coalition is meant in the state of São Paulo by many of our leaders in other different coalitions as the capital city of prevention. I'll let you know why we can inspire, and this community can inspire the rest of the state of São Paulo, because the leadership was very disciplined with the model. As Eric mentioned, the 3 pillars of this model really made all the change in our community. The local government and volunteers' participation could integrate, could collaborate with faith community for the expansion of the process and the credibility that was brought to the implementation of this pilot community, and all the changes that will be mentioned. The outcomes, after almost 3 years of this implementation, Pindamonhangaba, together with a partnership of a national research institute, could compare the sale of of drinks to minors and compared to the whole country of Brazil. And the comparison brought for 44% for this community coalition in Pindamonhangaba compared to the whole country of Brazil that had the facility of selling to minors in 70%. So this brought more credibility for local governments and also for the state government of São Paulo. They could know the news through the local media to the state media. So, and again, this community, after 4 years of implementation, also had, because we work with the strategists and no occurrences with underage drinking at the city's biggest public party in recent years. This party happens along all these years and even this year with zero occurrence for underage drinking because of the norms that were changed and all the law enforcement that was applied. And so this also impacts, and that's why we are called the capital city of prevention, because this public party is very, very large. So we also can show another outcome. The survey was made in public schools between 2018 and 2012. And we have the average, the decrease of the percentage for once in a lifetime and for the last 30 days. But this happens because we are the oldest coalition implemented in our country, especially in the state of São Paulo. And for the last 30 days, the reduction of cannabis use really impact the neighboring cities and all the communities that have coalition in the state of São Paulo. But this impact of this pilot coalition as a process for scaling up for the expansion in the state was possible because after 4 years, the governor of the state of São Paulo supported a new law which created a monitoring system for the selling and consuming of alcohol beverage to minors. So here you can see all the representatives of the 12 sectors is one of the strong pillars of the community strategy. We have families, industries, law enforcement, justice, especially civil society. But the faith community also brings more credibility to our coalitions in the country. The expansion happened between 2009 and 2014 in the nearby, as I mentioned, in the region of Pindamonhangaba area, in the state of São Paulo, and also in the coastal cities. So this expansion made our credibility stronger for the state of government.
Elian, disculpa,
Yes.
nos están quedando muy poquitos minutos y quisiera hacer una pregunta que a lo mejor puede ayudar al resto de los participantes y ver si Eric también nos puede comentar. ¿Cuál es el eje central que ustedes creen que puede ayudar a la participación? Porque ambos modelos se centran en la participación y tú estás hablando de un proceso de expansión que ha sido interesante, pero sabemos que la participación comunitaria a veces puede llegar a ser difícil. Entonces, ¿qué recomendación darían ustedes para el resto de los países para poder focalizar el esfuerzo en la participación? Eric, estás sin micrófono, Eric, si estás hablando.
So for, community participation, so part of where Eliani was going next, right, is that when we talk about, if I may, let me go back to this. Because I do think this is an important question, and this is kind of part of the context, and I know we're running out of time, and Eliani's story talks about this trajectory. The important piece is when you get started, and as we get started in a new country that we've never been to, right? There's different approaches at different levels depending on where you are, but you have to start somewhere. So in many cases, when we're starting for the first time, it's completely new and foreign. And the best area of intervention is locally. So when we talk about this initial pilot, it's actually working with the local communities. As Ileani was mentioning in her story, they brought together all those 12 sectors, but in a very organic way where this process was facilitated in terms of having a conversation about what's happening in the community. What can all of you do about it? And how do we start developing a vision for what we want to achieve? So as they go through this process, they do need to start with a community assessment. They also have to develop a logic model, a theory of change. But one of the key drivers for this is that people need to own it locally. I think our friends in the Icelandic model mentioned it very eloquently that when you implement services and programs, many times with outside implementers, the minute the funding ends, so does the support to the community. So Ileani's story is one of community empowerment. In fact, this model is one of community empowerment. We need to equip communities with what they need to know, what they need to do to be effective change agents, but we also need to get out of their way and let them do what they know to do best because they know their communities better than anybody else. I will also mention, though, that that's the first phase. The second phase, though, and one of the things that I talk about a lot is practice-based evidence, right? In a lot of countries around the world, this isn't thoroughly studied like it's been studied in Europe and the United States. So it's important to surface what's working. Ileani's, talks about the Pinda Coalition because it was a catalyst, kind of a snowball effect, if you will. You can actually trace coalition development along a highway that runs through her community to neighboring communities, which is to say that once you get to replication and expansion, there's a peer-to-peer component where you can start to leverage that local capacity that you've established, but you also have something to show to decision makers in other towns and municipalities. And we take a different approach there, working a little bit more top-down, working with the system to develop core teams that are trained to replicate coalition development. People like Ileani, who facilitated this in an initial pilot phase, are now able to facilitate this replication and expansion, but we equip people in those communities, transferring knowledge, skills, and abilities for them to be the drivers and the implementers of that, of the work. And then, ultimately, once you get to a point, you replicate and you expand as much as Ileani has, and you're well into the double digits. It becomes, difficult for, say, if you're working with a national government, in the case of Ileani, state governments, to navigate with 42 coalitions. So it's important to have an umbrella association and systems and structures at that level that kind of serve two functions as a national association. One being that they're that conduit that brings the coalitions together to share best practices and lessons learned. One coalition's weakness is another coalition's strength. But it's also an opportunity to bring decision makers at different levels, local, state, federal, to be a part of that discussion. So that what is it that we want to do with all of this? We want an approach that is policy driven, top down, but as it is in many cases, and we're working with groups in other parts of the world, we talk about it's difficult to get the boots on the ground to make these things move. Ileani talks about this when she's talking about alcohol policy in Brazil. There were laws, but the application of those laws locally, the mechanisms were not there. You needed people locally to drive that. So you need that bottom-up approach. And this is where the communities and the coalitions come in, so that we have a process that's both bottom-up and top-down.
Eric, Ileani, I think we have a few more minutes so that Ileani could finish her story.
Sure.
Can you help me with the slides?
Absolutely, Ileani, and I believe.
All right, one more
here
right here. One before Eric, just I'll go fast. So the support and the partnership with research institutes, universities, and colleges for the community assessment, that's one of the pillars of the coalitions and the CADCAS model, really impacted in our country because we never had that. We never had the data. We never had research being done. So this made all the changes. Next. So this partnership was very, very important. As I have already mentioned, our strategy was to be in the most populous state. The São Paulo state has 45 million inhabitants. See, we do have 645 communities and only 13 coalitions. But now the good news is the scale up permitted that. And now next slide. So the other states where we could expand, because we are in the area between two very important capital cities, as I mentioned, Rio de Janeiro and São Paulo. And the great challenge was without fundings, without national fundings, we also started one coalition in the northeast area of the continental country, that's Brazil. Next. But the good news now, one more, Eric, just to end up. The benefits of being an association means that this brings visibility and recognition at the government level, work optimization and regional level. Now we signed an agreement with the state of São Paulo and we will be funded. So our association will be funded for 12 more coalitions. This is the first time we scaled up to a national, not a national funding, but a state level funding in São Paulo state for 12 more coalitions. And the approval was March this year. I also forgot to say that we do have this consultative status with ECOSOC since last year, the last to be ending. I think one more slide and I'll be done. So it's when the agreement was signed in national level and also with the state of São Paulo level, state of São Paulo government, and where the funding is coming now for the expansion. So the credibility through the work of these years, all these years, really made us the good news for the country. So because before, the only work seen in the national law was the treatment but not prevention. So now they can talk a little bit more about prevention in the state of São Paulo. So the last, the Youth Council. If you can go to the Youth Council, sustainability through, okay, it's very important that our NGO has a Youth Council now that has been impacting because we have the youth voice. And to end up, the scale was that this girl here was 15 years old. Now she's 27 years old, and she's the executive director of the Pilot Community Coalition, Pindamonhangaba. I was the director, and now she's the director for these last 3 years. She talks to justice, to local government, to education department, to all her colleagues, and there is a council created in these last three years. So they have representatives throughout all the coalitions in the state of São Paulo. So to have the youth voice, it makes a difference too. When we go to government meetings and we have the youth voice together, that impacts our representatives, and that has been successful for our country that didn't have anything 20 years ago about prevention. So to show the outcomes, that's all. Thank you for listening.
Thank you, Eliane, because I think we will be cut off in 2 minutes. I just want to say, Eliane and Eric, thank you so much and congratulate on your wonderful work. It's really inspiring, and I hope we get a chance to talk more about how we can work the Icelandic model with what you're doing, because we are speaking the same language.
Thank you.
Absolutely, it would be a pleasure. Thank you.
Gracias.
Thank you all.